Good day, everyone. Today I'll be presenting a comparative analysis of leadership styles between for-profit and nonprofit organizations in the hearing device industry. My name is Tatanjia McNamara, and this presentation examines how different organizational structures influence leadership approaches and ultimately impact the communities they serve. We will be comparing Cochlear Limited, a global for-profit cochlear implant manufacturer, with Let Them Hear Foundation, a nonprofit organization providing hearing services to underprivileged populations. Let's begin by examining our for-profit organization, Cochlear Limited. Cochlear's distinct purpose is to design, manufacture, and supply cochlear implants, bone conduction implants, and related hearing solutions specifically for individuals with severe to profound hearing loss. Their mission statement clearly reflects their commitment to connecting people to sound, stating that they aim to, quote, help people hear and be heard by connecting them to a world of sound, end quote. This purpose demonstrates how for-profit organizations can balance commercial objectives with meaningful patient outcomes. Cochlear's funding model exemplifies the for-profit approach. Their primary revenue comes from device sales, including cochlear implants, sound processors, and accessories. What's particularly interesting is their post-implantation recurring revenue model through processor upgrades, accessories, and repairs. In 2024, their revenue exceeded $1.8 billion globally, with geographic revenue streams spanning the Americas, Europe, Middle East, Africa, and Asia-Pacific regions. Their target audience is quite diverse, including healthcare providers like ENT surgeons and audiologists, patients with severe hearing loss, parents of children with congenital hearing loss, insurance companies, and regulatory bodies. This broad audience base reflects the complex ecosystem required for successful medical device commercialization. Cochlear's organizational values clearly reflect their for-profit orientation while maintaining focus on patient care. Their 5 core values include innovation, technological advancement, clinical excellence, and patient outcomes, global accessibility and market expansion, shareholder value creation, and regulatory compliance and quality assurance. These values demonstrate how successful medical device companies must balance profit motives with genuine commitment to improving patient lives. The organizational norms at Cochlear illustrate typical for-profit medical device operations. They operate through profit-driven decision-making, competitive market positioning, and significant research and development investment. Their performance-based compensation structures and quarterly financial reporting requirements create an environment focused on measurable outcomes and continuous growth targets. These norms drive innovation but also create pressure for consistent financial performance. Cochlear's goals reflect their market leadership position and growth ambitions. They currently hold 50% of the global cochlear implant market and aim for continued market share expansion. Their objectives include revenue growth and profitability maximization, new product development, and technological innovation, geographic market penetration, and regulatory approval for new devices. These goals demonstrate how for-profit organizations can drive industry advancement through competitive ambition. Cochlear's vision statement, to connect people to a world of sound and help them live fuller, richer lives, beautifully encapsulates their purpose. This mission shows how successful for-profit organizations can create compelling visions that align commercial success with meaningful human impact. The mission speaks directly to the transformative nature of their technology while maintaining focus on patient quality of life. For For those interested in learning more about Cochlear's products and services, their official website at cochlear.com provides comprehensive information about their technology, patient resources, and corporate information. This concludes our examination of the for-profit organizational model. Now let's shift to examining our nonprofit organization, Let Them Hear Foundation. Their distinct purpose is to help hearing impaired individuals hear, the acronym which stands for Hearing, Education, Access, and Research, specifically targeting those lacking adequate access to funding and healthcare resources. Founded to provide cochlear implant and pediatric hearing aid programs for underserved populations, this organization represents the mission-driven approach of nonprofit healthcare organizations. The funding model for Let Them Hear Foundation illustrates the nonprofit approach to resource generation. They rely on individual donations and philanthropy contributions, patient fees on a sliding scale based on their ability to pay, charitable foundations and grants, corporate partnerships and sponsorships, and fundraising events and campaigns. Notably, they have a policy against accepting third-party advertising revenue, maintaining their mission focus. Their target audience reflects their service-oriented mission: underprivileged American youth needing hearing services, low-income families unable to afford hearing devices, healthcare professionals requiring cochlear implant training, international communities lacking hearing healthcare infrastructure, and donors and volunteers supporting hearing health causes. Let Them Hear Foundation's values clearly distinguish them from for-profit organizations. Their core values include service to underserved populations, equity in healthcare access, compassionate care delivery, educational empowerment, and mission-driven impact over profit. These values demonstrate how nonprofit organizations prioritize social impact and community service above financial returns. The organizational norms at Let Them Hear Foundation reflect their community-focused approach. They operate through collaborative and partnership-focused approaches, sliding scale fee structures based on patient ability to pay, volunteer engagement and community involvement, transparent use of donated funds, and impact measurement over financial metrics. These norms create an environment where success is measured by lives changed rather than revenue generated. Let Them Hear Foundation's goals demonstrate their commitment to maximum impact and accessibility. They aim to maximize the number of individuals served regardless of financial capability. They train healthcare professionals globally, having already trained doctors in 17 countries, and achieve healthcare coverage expansion. They've helped 126 million Americans gain coverage, develop international programs and outreach, and create sustainable service delivery models. These goals show how nonprofit organizations can create systemic change beyond direct service provision. Let Them Hear Foundation's mission statement to help hearing impaired individuals hear, specifically those lacking adequate access to funding and healthcare resources, directly addresses healthcare equity issues. This mission demonstrates how nonprofit organizations can focus specifically on serving vulnerable populations that might be underserved by traditional market-based approaches. For more information about Let Them Hear Foundation's programs and services, their website at letthemhear.org provides details about their global impact and ways to get involved. This concludes our examination of the nonprofit organizational model. Now let's compare the leadership styles between these two organizations. Cochlear Limited employs transformational and transactional leadership styles. Their transformational leadership inspires innovation and long-term vision for hearing restoration technology, while their transactional leadership manages daily operations with clear performance metrics and financial targets. They also employ strategic leadership focused on market expansion, competitive positioning, and technological advancement. Their ethical work standards include FDA and international regulatory compliance, clinical trial transparency, intellectual property protection, corporate governance, and quality management systems. Their leadership motivations center on financial performance, market leadership, technological innovation, global market expansion, and professional recognition. In contrast, Let Them Hear Foundation employs servant leadership characteristics. Their servant leadership prioritizes, community needs and patient well-being above organizational interests. Collaborative leadership works through partnerships and coalition building, and mission-driven leadership guides decisions by social impact rather than profit maximization. Their ethical work stands on focused, patient-centered care, regardless of ability to pay, transparent financial stewardship, cultural sensitivity in international programs, volunteer protection, and evidence-based medical practices. Their leadership motivations emphasize social impact, healthcare equity advancement, professional development, sustainable service delivery, and long-term community empowerment. The success determinants for each organization reflect their different priorities and operational environments. For Cochlear Limited, key success determinants include innovation leadership through continuous research and development investment, regulatory excellence in navigating complex global environments, market access through insurance coverage optimization, clinical outcomes demonstrating superior patient results, and global scale leveraging of economies of scale. Their current challenges include regulatory complexity across international markets, economic uncertainty affecting healthcare spending, increasing competition from Med-L and advanced biotics, technology integration requirements for AI and digital health, and cybersecurity protection for connected medical devices. For Let Them Hear Foundation, key success determinants include partnership development with healthcare providers and funders, impact measurement to maintain donor support, volunteer engagement of skilled professionals, financial sustainability through diversified funding resources, and program scalability while maintaining quality. Their current challenges include funding volatility with 55 to 60% annual donor turnover, federal funding cuts reducing government support, economic pressures decreasing charitable giving, capacity constraints limiting resources to meet growing demand, and volunteer recruitment for international missions. Looking at industry trends for 2025 to 2030, the for-profit medical device sector is experiencing significant transformation. Current trends include AI integration for predictive diagnostics and personalized treatment, digital health with connected devices and remote patient monitoring, regulatory evolution with streamlined AI device approval processes, and sustainability focused on environmental considerations in manufacturing. Areas needing improvement include faster regulatory response to evolving FDA requirements, cybersecurity enhancement for connected medical devices, cost optimization, balancing innovation with affordability pressures, and global access expansion in emerging markets. Key projections show the global medical device market expected to reach $679 billion in 2025, expanding at 6.9 compound annual growth rate. AI-enabled medical devices are seeing significant growth with 1,016 FDA-approved AI ML devices as of 2025, We are also seeing increased focus on value-based healthcare and greater integration of wearable technology. For nonprofit hearing organizations, current trends include partnership models for collaborative resource efficiency, technology adoption for donor engagement and service delivery, evidence-based impact with increased emphasis on measurable outcomes, and global outreach expansion of international programs. Areas needing improvement include donor retention, addressing the critical 55 to 60% annual turnover rate, sustainable funding, developing diversified revenue streams, operational efficiency, leveraging technology to reduce administrative costs, and professional development for staff and volunteer retention. Projections for the next 5 years to 2030 include continued pressure from federal funding cuts requiring increased private fundraising, greater emphasis on collaborative funding models, increased use of telehealth and digital tools, and growing focus on advocacy and policy change to address systemic healthcare access issues. For my personal leadership style preference, I would adopt transformational leadership approach that incorporates key elements of servant leadership. This hybrid style will allow me to inspire innovation and drive technological advancement while maintaining a patient-centric focus that ensures all decisions prioritize patient outcomes and accessibility. The transformational aspects would include inspiring innovation to drive technological advancement, creating vision to develop compelling long-term goals, empowering growth through professional development, and providing change leadership to navigate the rapidly evolving healthcare technology landscape. The service leadership integration would include patient-centric focus, ensuring all decisions prioritize patient outcomes, community service balancing profit motives with genuine commitment to hearing health equity, stakeholder empowerment, developing capabilities in team members and communities served, and ethical foundation maintaining unwavering commitment to patient safety and healthcare equity. Why this combination? The hearing healthcare field requires both innovative thinking to develop breakthrough technologies and deep commitment to serving vulnerable populations. This leadership style would enable balancing commercial success with social responsibility, inspiring teams to pursue both technological excellence and accessibility goals while building sustainable organizations that can weather economic challenges while maintaining mission focus and creating lasting impact through both innovation and service. This approach recognizes that effective leadership in healthcare technology must serve multiple stakeholders: patients, healthcare providers, investors, and society, while maintaining the highest ethical standards and commitment to improving human lives. Throughout this presentation, I've drawn from extensive research, including official websites from Cochlear Limited and Let Them Hear Foundation, industry reports on medical device trends and nonprofit funding challenges, academic sources on leadership styles and healthcare organizations, and current data on regulatory changes and market projections. All sources are listed here for your reference and further exploration. I'd like to share a personal note that brings additional perspective to this analysis. I am a bilateral cochlear implant recipient as of 2022 after wearing hearing aids for over 40 years. I was diagnosed with inner ear nerve damage that is genetic and has passed down through the female line in my family. My cochlear implants are from Cochlear America and have increased my word recognition from 0 to 2% pre-implantation to 95 to 98% at 6 months post-implantation. This personal experience gives me unique insight into both the technological excellence that for-profit organizations like Cochlear can achieve and the critical importance of organizations like Let Them Hear Foundation in ensuring access for those who might otherwise go without these life-changing devices. I plan to pursue a Master of Arts in Strategic Communications in Healthcare Communications focus and pursue a PhD to develop programs that improve patient-provider communications, combining my personal experience with professional expertise. Thank you for your attention today. This comparative analysis demonstrates that both for-profit and non-profit organizations play crucial roles in the hearing healthcare ecosystem. The future of hearing healthcare depends on continued collaboration between these organizational models with leaders who can navigate the complex intersection of technology, business, and social responsibility. I'm happy to take any questions you may have.